Hi there, it's Dr. Ryan, and today we're going to talk about the generational decline and ramifications of low testosterone for the SummaUp webinar. Um, the purpose of this webinar is to educate you on the implications of low testosterone and guide you to a physician who is successful in prescribing therapeutic testosterone, which will thereby allow you to achieve optimal health. So let's go ahead and get started. Um, we're actually going to start with a little history behind testosterone. Testosterone is the hormone responsible for normal growth and development of male sex characteristics. It's essential for every aspect of a man's physical and mental health. Testosterone formulations first came into existence in 1935 where steroid chemist Adolf Butenandt of Schering collaborated with fellow chemist Leopold Ruzicka and partially synthesized them from a cholesterol base. The pair was awarded their Nobel Prize in Chemistry in 1939. Testosterone esters were subsequently developed in the 50s, and these were designed to reduce the speed at which testosterone breaks down in the human body. And during this time, this was called the golden age of testosterone chemistry. Using these testosterone esters allowed physicians to better study and effectively treat a variety of medical conditions, which included hypogonadism, anemia, wasting diseases, and postoperative recovery from many different surgeries. However, even with all these advances in medicine, the modern day reality is this: testosterone levels in men are dramatically decreasing and have been so for the last 20 years. Um, so I guess the question is, why is this occurring? Why is there a population-wide decline in testosterone over the 80s, 90s, and 2000s? Many researchers point to environmental factors, worsening diets, obesity, but we're not really sure what the key cause is. What's more concerning, of course, is if we extrapolate this trend into the current day position, this is clearly a crisis that's going to continue to escalate and get worse. And while the medical community is attempting to combat the issue by prescribing a wide range of therapeutic testosterone protocols for their patients, there isn't a standard protocol for optimizing hormone levels for men or women. The reason why low testosterone levels are a crisis is because of the important biologic effects that they impart on brain development and function throughout male and female life. Okay, so let's talk a little bit about testosterone in the brain. Testosterone regulates the response of the amygdala, so that's a key brain structure for generating, processing emotions, and the prefrontal cortex, another area of the brain that's involved in regulating emotional responses and reactions. It's also essential to the regulation of insulin, glucose, and fat storage. It impacts aromatase enzyme activity. So aromatase enzyme is the enzyme that converts testosterone to estrogen, and so it impacts the concentrations of it within the brain. And there are testosterone estrogen receptors in the brain that can modulate behavior. The brain is heavily dependent on testosterone to boost dopamine. Testosterone enhances dopamine release in the mesolimbic system, which is often referred to as the reward pathway and thought to be important for motivation, emotion, and executive functions. Finally, many studies have shown that testosterone improves working memory in men and increases cognition. And so this is really key because if it drops, processes involved in gaining knowledge and comprehension can drop dramatically, and anyone involved in a pretty dynamic work environment knows how detrimental that can be. So, as I mentioned, low testosterone is a pretty widespread problem. According to the U.S. Census Bureau, approximately 15 million men suffer from testosterone deficiency. A pretty recent study showed that up to 40% of all tested men for, of course, serum testosterone were dealing with suboptimal levels of test and thus were suffering from the effects. Male hypogonadism is a recognized medical condition which unfortunately is dangerously underdiagnosed by many doctors. And this is important because lower concentrations of testosterone increase your risk for age-related diseases, depression, and infertility. Speaking of those issues, let's talk about them a little bit more. So there are a number of negative health effects that are caused by low testosterone men. Starting with your mind, Depression is very much linked to decreased levels of testosterone. Many studies have demonstrated this. Brain fog or inability to think through things clearly and quickly is also, or cognitive issues in general, are also associated with low blood levels of testosterone. And many men who have Alzheimer's disease, incidentally, also have low levels of testosterone. What about on your body? Well, low testosterone, as we mentioned, is directly correlated with an increase in fat storage. And there's multiple studies that look at older men who have low testosterone levels, and all of them have noted that it's associated with lower skeletal muscle mass, lower muscle strength, physical function, bone mineral density, and thus a higher risk of fractures to those bones. And what's kind of interesting is testosterone can actually reduce levels of inflammation in your body. And so suboptimal levels have been associated with generalized inflammation, and which is shown by an increase in cardiovascular disease markers, mortality, diabetes, and metabolic syndrome. So along with these studies, there is clinical experience, of course, to back this up. So there have been reports from hundreds of thousands of men and their doctors prescribing testosterone optimization therapy, which indicate that it provides a wide range of benefits, such as increased mental focus, elevated mood and confidence, increased muscle mass, decreased body fat, a healthy heart, high sex drive, and strong erections. So, in terms of obtaining therapy, it sometimes can be difficult to do so. A lot of men don't report these symptoms, particularly the ones that are sexual in nature, because they're embarrassed. Other men are conditioned to accept that, hey, these symptoms are typical of old age and therefore, are unfixable. Don't be embarrassed about these symptoms, and talk to your doctor if you have some concerns, and see if you can get your testosterone levels checked to see if they are indeed low. It's essential to consult with a physician with appropriate training and a considerable practice-based experience. There are many practices out there, and practice models can vary. So, unfortunately, your results can too. And then realize you're not alone, and you're among a large cohort of similarly affected men. The number of patients with testosterone prescriptions continues to rise yearly, with the latest estimate being 3 to 4 million men being prescribed testosterone. Okay, so we've reached the end of the presentation. Let's go ahead and recap some of the points. We started with the truth about testosterone, how formulations first came into existence, and the golden age of testosterone chemistry. We identified what testosterone does in the brain and how it is essential for physical and mental health. We covered how testosterone levels in men are dramatically decreasing, and male hypogonadism is often underdiagnosed. This is important because lower concentrations of testosterone can increase your risk for age-related diseases, depression, and infertility. Finally, we talked about how important it is to be honest about all of your symptoms and seek therapy from a physician who's successful in prescribing therapeutic testosterone. And that's pretty much the end of the webinar.